The current focus of immune checkpoint inhibitors in bladder cancer is in the advanced or metastatic space, with the approval of different drugs in that setting, and the investigation, intense investigation, not just in platinum refractory disease, but also in the frontline setting. But that's not the whole story. There is a bigger picture, and that bigger picture is about bringing the drugs earlier into the disease. The reason why that's important is, although we're getting long-term durable remissions in platinum refractory disease, what we are not doing at the moment is curing the majority of patients. And it might be that the best way to do that is actually to investigate the drugs earlier in the adjuvant setting, and there are a number of adjuvant studies. There's a nivolumab and an atezolizumab adjuvant study and a pembrolizumab adjuvant study. And also one could look in the neoadjuvant space. In fact, we're doing a neoadjuvant atezolizumab trial to see if we can downstage the tumour, but also induce long-term durable remissions by giving the drugs prior to the cystectomy. Further work's going on even earlier in that non-muscle invasive space to try and prevent the need for cystectomy, which is going to be really important for patients. So the story has a number of chapters. We have had the first chapter in cisplatin refractory disease. We haven't yet heard or completed the frontline story with the three or four randomized trials reading out over the next 2 or 3 years. But then comes this wave of very important work looking at the surgical space and the perioperative space. And it may be that that's the place where we, in the long term, can make the most influence.